Tahmid, you lead a number of our care home accounts at the PR office. Can you talk us through a few of the main challenges that you've seen with the COVID-19 outbreak?
I think the biggest challenge has been keeping all the different stakeholders that apply to a care home updated in the right way at the right time. In normal times, it's really easy to keep stakeholders updated because you're sort of doing it every so often, again, in the right way at the right time. But whether it's residents or staff or relatives or other providers, whoever it is, you don't need to communicate as often. In a time like this, especially when relatives aren't able to see their loved ones in person, it's so essential to communicate a lot more regularly and a lot more specifically as well. And that's been a real challenge in various ways. But there are more stakeholders now in play than there have ever been at the same time for a lot of the care homes that we work with. So it's not just residents, relatives, and it's not just staff that need to be kept updated every single week. It's also the commissioners, it's public health, it's the regulators, and also the public, who do have a really important stake in this as well, because everyone cares about what's going on in our care homes. And that's something that all providers are recognising and will continue to have to recognise moving forwards.
So, I mean, I think what's really interesting from looking at the news is there's three main issues that keep cropping up with care homes and across the care sector really, and they are PPE. I guess a care home specific one are outbreaks in homes, and then the third one, which is again across the sector, is keeping staff engaged. How have you approached those challenges with the care homes you work with?
I think there's been a recognition that whilst they all definitely are their own individual challenges, they all link and they need to be treated in tandem with one another. In particular, PPE and staff, I think, which I'll talk about first. PPE, the guidance has changed so often, and that's because nobody really understood this virus early on, and our learning and our understanding of the virus is constantly changing. But how you communicate what PPE is being used and what PPE is available and needs to be used from a clinical side is very different to how you communicate that to people who don't understand the clinical side. And that's been a real challenge for a lot of care homes across the country. I think people expect to see the full hazmat suits and that sort of thing, but there's a recognition, especially from people who are working in the sector constantly, that you need very different PPE if you're working in an intensive care unit versus what you need in a care home, because the needs of the people that you're supporting are different. Being able to communicate that message effectively has been really important across the care homes that we work with, in particular on staff morale, because the staff, and this is something that I found really heartwarming actually and really noticeable, the staff see the home that they work in as an extension of their family. The residents and their colleagues are an extension of their family. And so, as you would with your own family, you want to understand why decisions are being made that affect them, and you want to have a say in those decisions as well. And keeping staff informed in that way has been really important and will continue to be important, because that goodwill is always there, but now more than ever, we need to sort of maintain that. As for outbreaks, I think that's a unique challenge in of itself. I think it's nearing 50% of care homes where there have been outbreaks, unfortunately, so far. Again, it's about communicating regularly and often. This is an incredibly difficult time for so many people. As I said before, it is obviously affecting staff and relatives very acutely, but also something that the general public has an understandable stake in. And what we've tried to do across the homes that we work in is to make sure that everyone is kept updated, everyone is informed of the changes and decisions and when they're being taken and why they're being taken. And that's something that will have to continue over the next weeks and months ahead.
Yeah, and I think that's only going to get more intense as we're approaching this weekend. We're expecting some sort of announcement as to what's going to be the next stage, what's going to be coming out of lockdown. And the care home sector, as you rightly pointed out, went into lockdown earlier. But with the lockdown now becoming less restrictive, there's going to be more of a blur of messaging. At the moment, it's very clear: stay at home, protect the NHS, save lives, easy strapline, stuff we can all relate to. I think as things become more blurred, and some families have not seen their relatives now for 2-3 months, which is a really, really long and very difficult thing to do. So I think that as we're getting more blurred, it's going to be even more important for care homes to communicate what they're doing and how they're doing it, just to give public that reassurance and ensure just so that relatives know exactly where they're standing.
Yeah, and I think you're spot on. I think the onus is going to end up being on the care homes themselves, because the government is going to be communicating about all sorts of things, from, you know, NHS to businesses and everything in between, and schools reopening. The onus really on the nuance is going to be on the care homes. And that is a unique challenge. There's been a lot of goodwill built up from residents, loved ones, in terms of, you know, recognizing why these measures are in place. But when the measures stop applying to them and only apply to care homes and other vulnerable groups, that's going to be a bigger challenge. And I think what we need to be really conscious of, and we're constantly in discussions to plan for this, is to make sure that the residents, loved ones and next of kin, etc., understand that there will probably be some further restrictions in place for care homes beyond the restrictions that are in place for the rest of society. And making them understand that early is really important, and that's something that we're working on every day with the care homes that we work with.